Hey, ladies and gentlemen, possibility seekers all around the world. It's Rob Hardman here today, and I'm super excited because we've come through a pandemic, and I've been really wanting to speak to a specialist in the healthcare environment. And today we are so blessed because we've got Charmayne Thompson, who's a healthcare executive based out of Melbourne. And she's going to tell us all about this and leadership. How exciting. Welcome, Charmayne. How are you?
G'day, Rob. Thank you. Pleasure spending some time talking to you this afternoon. Thanks for having me.
Yeah, no problem at all. Hey, this is the It's All Possible podcast. So one of the things we always ask our guests, Charmayne, I know you're a big believer in this in any way, but what does the word possibility mean to you?
Look, possibility to me means, things happen if you take a risk, and this risk is met with courage and faith, I think for my career and my life, my parents certainly took a risk. We certainly migrated as a typical migrant family to Australia when I was age 18 months with $5 in their pocket. And my journey and my career has been made on taking risks. I sit here in a healthcare executive role, growing up in a family with not a lot, but have the pleasure of now leading and developing teams under my guidance. So motherhood, wifehood, sisterhood, being a daughter, friend, colleague, and executive leader have all been made possible by taking a risk with a lot of courage and a lot of faith behind those risks.
That's a great answer, Charmayne. I got to tell you, you know who you remind me of?
Who?
A great answer by Scarlett Johansson. She answered it very similar, and she said, believe it or not, because she's such an absolute rock star in her career, but she said that she basically, her whole career has been based on being not the first choice, right? Okay. And she's typically been second, third, fourth, or fifth choice, but she's been available, and she said yes, and she said she just lives on the other side of yes, and her career has been based on saying yes and what is possible and just putting one foot in front of the other when you don't really know where you're going. So I love that. It's a great answer. It's very similar to Scarlett Johansson. So it's fantastic. And you're in the healthcare sector. And I know that wasn't your first choice about the healthcare sector, because I think you originally wanted to do journalism. Was that right?
Yeah, I did, Rob. I loved watching, believe it or not, Yarn Event. With some of your listeners might remember on TV, but she was fabulous. And I thought, that's a great career. I loved current affairs, sat the journalism exam in, must have been 1990, and missed out on journalism by 2 marks. But I'm very blessed that I did miss out on those 2 marks, because then my girlfriend and I said, well, what are we going to do? Why don't we have a crack at this thing called nursing? And really have never looked back.
Isn't that interesting? And I think Yana went such an inspiration, wasn't she? I remember when she was doing the 60 Minutes and things like this. So that's probably aging us a little bit together, Charmayne. But
yeah, it has aged.
She was such a leader back then. And I remember even when she was doing 60 Minutes, just really not putting up with BS from people who tried to kind of roll her and try to just get over the top. I think she's such a great leader and really set the bar. So I'm not surprised you went for journalism, because she would have been such an icon at that point.
Yeah, she absolutely was. She sought out the truth, stuck by her guns, and followed her instincts, which is a lot of what we've had to do during this pandemic in healthcare leadership, actually.
So you're into healthcare. What do you like about healthcare?
Oh, gee, Rob, what's not to like? What we've got is a huge diversity of roles, and the contribution of all of them on a daily basis makes my job very exhilarating. I literally bounce out of bed every morning. No 2 days are ever the same. From a security point of view, we're always going to have work in healthcare. Never going to be unemployed. We're always needed. I'm a mother of 3 boys. There's a level of flexibility you don't get to make to this level that you can't find in other jobs. So very fortunate to be in healthcare. But perhaps the biggest reason to pursue a health career is to make a difference in the lives of others. And I think we all want to leave a legacy or an imprint on the world. And in healthcare and healthcare leadership, the touching of others through your actions, voice, or leadership is far more often than not profound. It's a real pleasure being a healthcare professional that we never take for granted. I think I struggled during the pandemic, because often you would have seen it all over LinkedIn, Facebook, the healthcare professionals with angel wings and superhero outfits. And you look at that, and I'm sure my colleagues out there go, wow, I'm not sure I want to be portrayed like that. This is just what we do, and we do it on a daily basis. Did we struggle through the pandemic? Absolutely. The last 22 months in Melbourne have been super challenging, but it's just what we do. We get on and we do, because we have one goal, and that's to provide that care to those patients in our care, and also to one another. Whether we're a cleaner, consultant surgeon, psychiatrist, obstetrician, finance manager, Our sector and every aspect of it aims to provide optimal clinical outcomes. And that's our lingo for making sure we do our best to look after our patients and minimise the risk of harm to them.
Yeah, I'm a huge fan of the sector. I just think it's amazing what the people do. I know I couldn't do it, and so I just have this total respect for it. So I've been doing some work in healthcare, Charmayne, and I was doing some work with a nursing group, some nurses more recently. And I was doing some discovery about what they do and how they do their work, a lot of things you just talked about just then. But one of them said to me, which you didn't say, she said, well, Rob, you've got to understand, nurses, we eat our young. What do you think she meant by that comment?
Yeah, look, it's an idiom that's probably been around for about 30 years. And I've been nursing, close to 30 years when I think back on it. Yeah. Obviously now in management. But, it doesn't mean we actually eat them. Clearly, we're not cannibals. But it does refer to some not so nice behaviours historically that we've done. I think, when you talk to nurses and the whole journey we've gone from nursing education. So nursing used to be like an apprenticeship. You used to get your nursing degree in a hospital. So you did your 3 years. I'm one of the first graduates that did our 3 years in a university, and I remember my first encounter of this idiom, for want of a better word, because I don't like using the nursing eat their young, was as a young graduate nurse or a senior charge. He had given me this white pill and had said to me, just give it to the old bloke in bed 9. And I just thought, hang on a minute, I have no idea what this tablet is, and I have no idea who the bloke in bed 9 is, so I refused to give it to her. Wow. Give it to the patient. Well, I encountered that idiom very quickly. But, I took a risk, and this is what I said to you, my career is a little bit about this risk-taking, where I took the risk of not directly doing what I was told in that vulnerable state that I was in. And this actually fell under the radar of the NUM of the ward, or the nurse unit manager of the ward. And she said to me, well, I know it wasn't popular last night when you refused to do that, but you actually did the right thing. And she said, that shows some leadership potential. And I went, oh, there you go, leadership potential early on. But my second and quite brutal experience of the same was more as a junior nurse manager, where my senior director had said, I put a business paper together and presented it to her. And in her lack of support for the business paper, her feedback spiel, she'd said to me, do you know what, maybe it'd be a good idea if I reconsidered my job, and that she was sure my husband would appreciate me more if I was home to wipe the children's faces when he got home from work.
Wow. And what century was this in? So in 18...
Yeah, correct. This was 2000s, early 2000s. I was a young mum starting my career. Crazy. And needless to say, she had my resignation the next day.
Right.
But they were lessons that I learned early and learnt well. Respect, empathy and communication skills were going to need to be part of my toolkit if I was going to progress in management and leadership.
So Charmayne, I'm interested in that. You talked about that being that first wave coming through, went to university, and you gave a lot of this just a second ago. Because I think it's fascinating. Because when I was in the US with John Maxwell, the John Maxwell organisation, actually with John. And John talked about that it wasn't until about 1995 the first books on leadership actually came out. And his was one of the first when he wrote Developing the Leader Within, because all the books previous were on management and tasks and that kind of management authoritative work. Now, whether it doesn't matter if you're male or female, they were kind of getting things around, the management by example, management by objectives. The leadership side, the value side, the people side was actually very new in the early 90s, wasn't it?
Yeah, absolutely. So I graduated in 94, and it was very still much of if you told you to do something, you did it, and that's how she managed. But the whole the leadership and I grew up with it. I was very fortunate actually to in my first year of management was put through a leadership course with a company you might know actually. It's a Proteus Enterprise, which is a leadership company here in Melbourne, and it was fabulous. It just
I think we've heard of them, Charmayne.
We've heard of those guys, the Proteus group. So it was fabulous to be able to work with them as well in that sense. But getting in tune with your people and them as your most valuable resource, and certainly I've held that very true to myself. And leadership is something I love. The management side comes as second nature and part of what I do, but the leadership is certainly the part of my role that I absolutely love.
So tell me, how do you lead? I'm going to get two parts of this. How do you lead a positive culture in an organisation? So answer that one, and then I'd really be interested to talk about how a pandemic affects that. So let's just start. So there wasn't a pandemic, but just how do you lead a positive culture in what you do?
I lead like how I'd like to be led. I think, we all come to work, we spend a lot of time at work. So we want to enjoy ourselves at work. I think the culture is certainly something that you catch. You can't teach culture. You absolutely, if you want your staff to be positive and engaged, then you need to be positive and engaged. You need to reflect that positivity and engagement at every opportunity. And sometimes that's when you're actually talking business, but often it's when you're having those corridor conversations or someone knocks on your door and they've got to share something personal about themselves. Leaders often say they're going to do something, but often don't deliver. I love the Maya D'Angelo quote that she says, people don't necessarily remember what you say or do, but they do remember how you made them feel. And that's so critical, and particularly during this pandemic. But certainly, the 5 minutes spent discussing, with your staff around a change process or a new idea or a problem at home with hubby, wife or kids all shape organisational culture. So staff need to feel safe with the leadership that surrounds them, that they can trust you, and in turn they can trust your decisions in the place where they spend most of their time. They're making decisions that impact on their life while they're at work.
You've touched on psychological safety there.
Absolutely.
We hear a lot of today, and I know you know Richard Dorr here, and Richard's a big advocate and a fantastic contributor on psychological safety.
Yeah.
What does that mean? What does it mean to you, psychological safety in a hospital?
Yeah, look, safety is our number one priority in a hospital, and most organisations will tell you that's what their number one priority is. The pandemic brought a whole new world of safety to us, and keeping our staff and our people safe. And the psychological safety was probably the most critical part. You would have seen the pictures of all of us dressed up in spacesuits and masks and gloves, but keeping people psychologically safe was arguably more important than keeping them physically safe during the pandemic. They felt psychologically safe, they turned up. If you don't feel safe at work you can't get them through the door. We can provide all the PPE, but keeping them psychologically safe was absolutely critical. Leading a positive culture doesn't mean you have to have all the answers. There were times where I just went, do you know what, guys, I don't know how this is going to pan out. I don't know. But what we did know is we had the resources and the tools to keep them safe. And we were very proud of that as a large private organisation in Melbourne, that we could get our team through that. We were able to provide them with evidence-based, and not, the media hype that surrounded all of this was going on in the background. But from a healthcare sector point of view, we stood strong. We had great leaders amongst our teams that could, including our chief medical officers and an executive team that supported the teams on the floor, and that was critical during that.
I like what you kind of broke down what you said then, Charmayne, because there was some real gold in that. And then what you said was, we didn't necessarily have all the answers, but what you did say was this. You said, hey, this is where we're up to. We don't have all the answers, but here's the evidence that we do have, and here's all the facts that we do have, and this is where we're going on the basis of that. Absolutely. I really like that, because it's you being very transparent and saying, look, we don't have the crystal ball, we don't know all the answers, but here we are, we're with you, very authentic. You don't know the answers, you don't know the answers, but what we do have is the evidence, the facts, the data at hand at the moment, and given that, we're going this way. And I said sometimes, because that's a bit different than leaders going, well, I don't know any more than you do, and then walking away, right? You can't do that, that's not leading, but you also can't not turn up, which I saw a lot of people during the pandemic, Charmayne. Leaders went AWOL. A lot of leaders just actually disappeared. It's harder to do in your environment, I agree, but actually disappeared because they were trying to get all the answers and didn't want to come back to their people until they had all the answers, which is pretty much impossible, an event that hasn't happened before.
Correct. Once a century pandemic, absolutely. I don't think anyone had the answers. It's difficult. I think the other good thing about culture is it's been consistent with the way you deal with people. So, the feedback of good work makes feedback of the not so good easier to do, is what I find. So, actioning, and we, before pandemic or no pandemic, actioning poor behaviour or not being on board or on the bus, I talk about it, people being on the bus going in the same direction. Yeah. If you don't action it fairly, regardless of what stance, and healthcare is very hierarchical. I don't know if you know that, Rob. Different hierarchies of nursing, doctors, all of the teams here is very hierarchical. If we tolerate and turn a blind eye to poor behaviour standards, we in turn accept the standards that these people are putting out. Standard you accept is the standard you walk by, and that's something that we try and live by. And it's important that I lead with no one person is more important than the other. Not to, the orderly or the cleaner gets the same good morning, hello as my consultant surgeon or the professor theatre of surgery. I think that's really important to have that standard, because in this hugely challenging private hospital sector environment, every single person is valuable. And as a team and critical in ensuring our patients and each other remain safe. If our cleaner doesn't feel, comfortable in speaking up, patient could get an infection, and that in turn affects their the environment that we're in. I do like to do a culture check now and then, just the team go, how are we traveling, guys? Is there anything we could be doing better? Is there anything the executive team need to be putting out there that we're not doing? We do regular staff forums for our teams to feedback regularly.
Hey, Charmayne, when you do that culture check, do you do that one-on-one, or you do that with the team as a group?
We do it as a group, but often they're in a team environment like that. We're all different. We've all got different behavioural styles, and I guess there are people that like to be outspoken and others that feel a bit uncomfortable speaking out in a big forum. So after a staff forum, we'll say, right, guys, you're always welcome. Come back to the office. Anything that we've raised here that doesn't sit right, come and have a personal conversation with us, and we're more than happy to do that.
Oh, that's really good, because I don't think. I would like that checking in again. That kind of, we're a big believer here, in terms of like a culture pulse. I would like the way you do that and covering off, because there are those people who have actually got something to say, but sometimes don't get a word in because you're dominating. I would like the way you know that, and you check in and let at least have access to them, or have them have access to you, so you get a fully rounded approach. And when the pandemic hit, what were the priorities for you as a leader when you thought, hey, this thing is actually big, we're going to be under pressure, or we're going to be under strain, or we're going to be in the lens here? What were some of the things that were on your top priority list?
I think the main thing I went was, geez, I can't know it all, and I'm not going to pretend like I do know it all. So keeping that vulnerability and that authentic leadership that I strive to, I always tell my staff, and I do spend a bit of time educating leaders, and I like to say to them, never forget where you came from. So always remember where you came from and how you would have felt if you were at that level. So put yourself back in your staff's shoes. The open door policy is critical. So the door's open most of the time. It doesn't mean I've got a few late nights and early morning starts. Yes, possibly. But it means when staff are here, the door's open for them to raise any concerns. We talked about keeping them physically safe, but that psychological safety was critical. Like I said, working for the large private hospital group was sensational because communication was coming down. We re-edited and sent out to our teams, which has made it very comfortable to communicate. But communicating from that top down and then from down up is just important. So we often forget we've got to give them that opportunity, like I spoke of, to come and communicate out what's troubling you, what's bothering you. Let's nut it out. Don't have the answer today. Let me find out and get back to you. Whether in person, or then we all went into the social distancing and not having too many people in the one room, and the 4 metre and the 2 metre squared rules. So it became Zoom was this, this platform that was so beneficial to get on and do some lunchtime learning or some lunchtime question sessions with staff where people could just openly ask via the Zoom platform.
Did Zoom help? When you said Zoom was really helpful for you, did you find that some of those people who are maybe quieter in a group environment were able to be more vocal during those?
Absolutely. The chat function is fabulous like that. You could put stuff in the chat, and there were rules in there that, you don't have to give a name to it. You didn't know if there was something that you wanted to ask, we just phrase the question and maybe not attach a name to it. So they absolutely felt more comfortable coming to those kind of things. We did management meetings via Zoom, took an opportunity to do some education via Zoom. It was just, reassuring the team was what it was all about. So that was my focus, pulling them together. If I'm brutally honest, I reckon it's brought our teams closer in healthcare during the pandemic. Something, if there's a positive, I'm always a bit of a glass half full leader, but certainly we were forced into the unknown, and we're coming out the other end stronger, more wiser, and arguably more connected.
And do you think that will continue in healthcare, to be where they saw the advantages of that kind of technology?
Absolutely.
Yeah.
Absolute efficiencies we all found, whether you're healthcare or not even to get up and go, 20 kilometres to a big group meeting and do it via Zoom. Absolutely, the efficiencies are there. There's still nothing like that face-to-face contact, and now we can give each other a hug or a well pat on the back. There's nothing like that, but certainly the Zoom and the advent of these teleconference, etc., is going to be used in the future.
And your take on now, because you and I are talking, we've just had the new variant of the Omicron come out. What's the take on it? Is this going to be another peak? Do you think that 2022 is going to be a little like 2021, and we're going to have to just get used to the virus? What's the hospital system thinking around that? So it's just going to be more of the same?
Yeah, I don't know. I'm hoping, we're watching and hearing about what's going on with our colleagues and families in Europe. the cousin of Delta Omni, the year that we're all hearing about. It's hard to say. I think the measure of COVID in Australia will soon be about the numbers in our hospital beds, and sadly about those who succumb to COVID. I mean, its impact on the health system and our professionals. I think we've used up all our resilience dust, I like to say. We're starting to use that up. It's tough coming back, and we hear it and it's there. But we already see the reporting of daily numbers. It used to be our focus at 11 a.m. call, with the Premier on saying how many cases. It's sort of falling a little bit off the radar. I think the peak of the hysteria is behind us. I think that's what I want to say there. Perhaps not there is modelling that suggests we may end up with a bit of a peak late December, but that's probably related to all of us mixing around. And, even the kids being back at school, my little boy came home with a slight cold, got him swabbed. It's a cold, but we're always going to, in this current time, we're swabbing and just protecting and making sure it's not COVID. But, I think the hysteria has stopped. The peak numbers may still come. And, we might get a COVID season like we see a flu season, but it's hard to tell. We've learnt what's most important, though, is what really matters on a day-to-day basis. We have to be okay. We will be okay, and we have to be okay. I think my optimism that we all have in healthcare, I have to reflect onto my team, who then reflect it to one another and in turn our patients. And I think that's critical for us moving forward in healthcare.
Yeah, and that's starting to build that positive culture we spoke about. Can I pick you up on one thing you said a moment ago? You talked about healthcare professionals and just the amazing amount of pressure they have been under and the hours and everything else that's been there. You also spoke about healthcare professionals having moral fatigue. What is that? Can you tell us more about moral fatigue, what you mean by that?
Yeah, look, in care provision in our roles, we turn up every day to care for others. It's perhaps a little bit inevitable that a phenomenon called moral fatigue would be labelled to us. It's applied to healthcare workers. Our work environment probably has more moral challenges than any other. But during COVID, our workforce was depleted significantly. We furloughed and we isolated staff, and this had a profound effect on those that stayed behind, but also our furloughed staff, because morally they want to be at work. We all want to give. That's why we're in this profession. We want to be on deck, want to be assisting each other. So we had a team of professionals that were here on site tired because they were picking up a bit of the slack that was left behind by our other co-workers who had to be furloughed and isolated, and we're exhausted. Yep, we are. Are they functioning at their highest when they're exhausted? Possibly not. But this moral fatigue of I have to be there because there wasn't enough of us to do our job. And I think that's important to note.
Isn't it? So the values of being I want to give, I want to help. And the reason it was really, I really understand what you mean by that now. That's really, it's blindingly obvious now. You've explained it, but I never kind of thought about it like that.
But I think what's important, what we learned out of this was in the mature cultures and the teams that are going to do better, including my own team. I think it was really important to support and care for one another. So if we were furloughing teams or furloughing staff, important to pick up the phone as a leader and go, hey, just checking in. You're furloughed because you're exposed, but you might be actually really well at home. That was, was it frustrating? Yeah, I'm just sitting at home reading a book. I could be at work. No, you're furloughed because you could be, you could be infectious in a few days. But touching base and making sure they were connected. And that's where Zoom, a ward meeting, you could dial in and do a ward meeting for wherever you were.
You feel like you're still connected. It's still
correct.
Connected.
Really important, really important.
Oh, interesting. Hey, you've done an amazing, you're one of, a really great female leader and probably a role model to many people. You talk about Yarn Event being a role model to you, Charmayne. I'm sure you're living that for a lot of other people as well. Do you think it's easier to be a woman in leadership today than when you started? Has anything changed?
Yeah, look, I think for women, men, I think leadership is leadership. There are good male leaders, good female leaders as well. I think in healthcare, either fortunately or unfortunately, we're a very female-dominated profession to start with. I'm, however, really not a fan of separating female leadership from male leadership, where I think we all have strengths and weaknesses regarding our DNA footprint. We live in a country of great privilege, Rob, and I think and our opportunities are abundant. We also have many leaders now who don't identify as male or female, and as such, our gender diversity opportunities in leadership roles are much greater than they were. Is it easier to be a leader today? I think our teams expect more of us as leaders, and they did, particularly in these unprecedented times of, this once-a-century pandemic. I believe we have more resources available to us. Have a look at this. We've got a podcast people can dial into and learn from one another. The blogs are just part of the leader toolkit now. But in all reality, leadership should never be considered easy, I don't think. There's too much at risk. I mean, as a leader, I exist to lead and develop, a huge weight of which I carry, but I carry that with the hope and the aim of making things possible. And this is, I love the name of this podcast, Possible for Others, ourselves and others, and our staff. I think that's essential.
Yeah, we were talking offline a little bit about comfortable and uncomfortable, and we were talking about leaders and how leaders need to be comfortable being uncomfortable. Can you explain a little bit about that? Just so leaders in general need to be comfortable being uncomfortable. What can you tell us more?
I think the minute you get too comfortable, it's time to have a look. I think there's always this uncomfortable nature of leadership. I mean, we currently live in a world where there's very limited privacy. The world's looking in and they're judging us, whether we like it or not. You know, we've got, I know the Truman Show is a classic show. My boys love watching the Truman Show, but it's almost like a Truman Show analogy leadership. Our truths and all the ad libs are all on show. We're recording, you know, we might say something on a Zoom and it's there forevermore. So it's really important, you know, to be aware of how we're interpreted, what we do on the weekends, how we raise, interact with our families, friends, our teams. It's all on show. There will be uncomfortableness in our leadership journeys, and we have to resign to that fact. There'll be decisions made, not made, that will make us feel uncomfortable for the rest of our careers and sometimes our lives. You know, in healthcare, these decisions can impact directly on the life of one of your team or even on the outcome of a patient's life. You know, there's always that high revenue earning stakeholder that may make your team feel uncomfortable, maybe behave inappropriately, and in turn you'll feel uncomfortable having a conversation with him, her, or they. And this will make us even more uncomfortable. I wrote this down and then had a giggle at it. The more comfortable we are at being uncomfortable, the less uncomfortable we'll feel in these circumstances. But it's true.
It's a tongue twister, but it's true.
Yeah, it is a tongue twister.
I think I like that one. When you're comfortable, you should take a look around. You remind me of the great book written by Andy Grove, the co-founder of Intel, called Only the Paranoid Survive, which is about just being on the edge, you know, just feeling like, what's next? What am I going to do now? What am I going to, you know, what am I going to connect with? Am I too comfortable? You know, have I got a bit too bureaucratic, or, you know, what's that? We got a little too easy. We should look around. I really like that. Of yours. And you're feeling like that.
I think in healthcare, there is no BAU. That's why I love it. You know, we started off with, you know, what's a day? There is no BAU. You know, something will happen in your day that challenges you. So you're not really truly comfortable because, you know, we're dealing with humans and their conditions and, you know, and the interaction of all of us as healthcare professionals and how we interact with our patients. Something will come under the attention. We have to change direction or pivot regularly.
So, Charmayne, aged care was hit hard by the pandemic in 2020. Asking staff to lead and work in foreign work environments would have posed a huge challenge. How did you and your teams lead through this?
Yeah, look, Rob, aged care was an unbelievable experience. Some of our hospitals took in aged care residents and some of us were asked to go out to the aged care facilities to support the workers out there. Keeping staff on site at our hospitals as well as those off-site at the aged care facility engaged during this team demanded the open and transparent leadership that we like to provide at all times. If you recall, Rob, at that time, about July last year, elective surgery in Victoria had been severely impacted in mid-2020. And we had nurses in subspecialties in theatre, surgical, medical wards have been preparing for ICU admissions. I remember the media we were purchasing these ventilators to cope with what we were going to need. And then it happened. We started seeing these images of the family members waving at their elderly loved ones through windows, FaceTiming via iPads, and these images will forever be part of the COVID experience. I think just having said that, some of my career highlights actually happened during this period. Unbelievable as an acute trained nurse that your career highlights happen in aged care. But Tim Novak, who's a leadership coach who I've actually heard speak on your program, had said that leaders can impress from afar but impact from up close. And geez, we got up close. We're now being asked to support our aged care facilities as they furloughed in many cases more than 50% of their care providers. And these care providers' basic needs are bathing, feeding and toileting. Remember, these are acute care nurses going in there. So the aim of the game for us as leaders was to ensuring our staff felt safe, valued in the work they were doing and also welcome in a foreign environment, which was aged care.
And when you say a foreign environment, so it was an environment that they had seen, obviously, and knew about, but they hadn't actually participated in.
Correct. For a lot of my nursing staff, including myself, one of my first placements as a junior nurse was in an aged care facility where you learnt the basic care needs of human care, washing, toileting, pressure area care, all of that stuff. But this time we were turning up looking like space invaders with all of our PPE and our spacesuits. In fact, one of the old people said, even though you're wearing those gloves, I can still feel the human touch. And that was pretty powerful to take away from that. And we know we're doing a good job when they have comments like that.
That's an incredible comment, isn't it? That they can, it just shows how powerful it is. I think really when you see that come through the eyes, doesn't it? The eyes.
Correct.
Even though you're wearing a mask, you're wearing PPE, you're wearing rubber gloves. That patient said I could actually feel it, even though it's gloves. That's great, isn't it?
Yeah, and for us as leaders, how do we get that trust that we're going to send these staff to? For me, we orientate our staff to hospitals when they get their jobs there. How do we orientate them, make them feel safe in the aged care? So we went out first. And again, being part of such a big company, it was awesome to get the support from head office. And often, all of us say, head office, they make decisions, they're not on the floor at times. But during this time, the spin-off of this COVID crisis has been the interaction and support we've received from the head office. Being visible, being out there, doing some site assessments with people from head office was just something I will never forget. And our nurses on the floor, don't forget that either, or our caregivers on the floor. That was a real good feel-good moment for our company. And certainly since then, it's brought us as a company closer together. In leading it, I think being on the face of it, like being out there, is really important. So one of my favourite memories was an elderly lady who we call SCOVID. So she was a suspect COVID, so full PPE, but I just noticed that her fingernails had she had a pink tinge to a couple of her nails, but some of them had worn off. I said to her, your nails need a bit of painting. She said, yeah, I can't get anywhere. They've closed the salon at the nursing home and now I'm here with you guys. And so I just said to her, what about I bring my nail polish in from home and do your nails? And well, it was one of the highlights. And we, in the human factor and the human element of COVID, that was one of the most powerful moments actually. And she was so grateful. And things we forget in wearing our PPE and stuff, but behind that is an elderly woman who wants to look nice and present well to the world, which we all do.
Such a beautiful touch.
Yeah. So yeah, it was a great time. Our team, as I said to you earlier, it was all about bringing the team together and sharing stories from the hospital team that were here holding the fort, as well as the team that were out in aged care facilities, bringing them together as a team, presenting, our pictures and our stories. And it is a great story of what we were able to do and how we were able to impact so many people, our staff and our aged care residents included. Very powerful and something I don't forget.
Fantastic. Yeah, really great experience. Now you reflect, and I know that you're a big believer in journals. What attracted you to start journaling?
You know what? I feel like a bit of a fake in that. I probably have only started journaling in the last 3 or 4 months, Rob. But I tell you what, in uni, sorry.
So what brought you? So even in the last 3 months, I'm just interested to know why you started.
Yeah, look, a well-respected senior colleague of mine was sitting down to have a drink one night after it was one of those days. And she said, you know what, you should write a book about this journey that you've been on the last 22 months. We've certainly done a lot as a team out here. And when I started to record the 22 months and we were chatting and she asked me what I remember most, I thought, geez, I better start writing this down because there is a chance that in a few months' time I might forget these, moments of laughter, joy. So one night soon after that conversation, I was scrolling through my LinkedIn and try to engage with some sleep after doing the school lunches and after doing 2 loads of washing and all the other stuff we do as mum leaders. And I saw this post that was on LinkedIn. It was about this, hashtag this little girl movement that I felt compelled I had to contribute to. And Rob, you won't believe, it took 5 minutes to write this post and it got 23,000 views within 3 days. I thought, well, there's something people want to know about healthcare and leadership. So I'm blown away by that response, and I just wanted to capture these moments as they happen. So at night now, before I go to bed, I just write down 3 quick lines, what I'm grateful for, what I've learned today, what made me feel uncomfortable, and it just sparks that, what's gone on in my day and what can I reflect on in a few years' time. But, at times I get quite emotional just before I go to bed because as I write, I find joy. I find joy through sometimes pain, through laughter, through satisfaction, angst, frustration, anger, fear, grief, despair, sad, all of these emotions just come to the front as I start writing. But overall, a huge sense of pride in the teams that I belong to. And these teams, importantly, they're just not my work teams. They're my family, which is my big team at home, my 4 boys, if you include my 3 boys and my husband, my work team. And also, I think as leaders, you have to look at Team Charmayne or Team Rob, because if you're not supporting yourself, how do you expect others to? And I think that's really key. As I sit and reflect on my day, I think, what have you done to support yourself in these decisions? And sometimes I haven't done a good job at that. And reflecting on that is really important, I think.
I love that concept. There's a whole concept in my book, It's All Possible, on Team Charmayne, Team Rob, because it is really important to have that team around you. And the journal that I did following my book was just very similar to yours. And I had a couple of questions in there. One was, what made you happy today? Another one was, who did you make happy today?
Yeah, nice.
And what I was amazed by, Charmayne, was how many people wrote to me saying that second question was a game changer.
Yeah.
Because when you reflected upon who you made happy today, and it might be nobody, by the way, on a couple of days, but when you actually went out of your way to make someone happy, you became happy. That's it. The second question drove the first one.
Amazing.
It was fascinating. Fascinating. So they're really interesting. I'm glad you're journaling. I think it's really good. And you do have lots to say, but as you say, it also allows a bit of outpouring, doesn't it, at the end of the day?
Absolutely.
So for all you, and I love this term you just dropped in there, by the way, mum leaders. I like mum leaders. The mum leaders who are doing the 2 loads of washing, getting the lunches organised, getting your 4 boys sorted out, because I'm in a similar family dynamic than you are, getting them organised, and then you have your mum leader time.
Yeah,
I think that's really important. A good question for you, Charmayne. Given this amazing journey we've had to date with you, because in my belief, you're only starting your leadership career. If we got in the time machine and we went back in time and we caught up with 15-year-old Charmayne, what words of advice would you have for her?
What words would I have for advice? Probably don't get that spiral perm at age 16 because it wrecks your hair forever.
That's me and you both.
Yeah, but look, really, I think what I'd say to her is you're going to come across, the naysayers, the non-believers that tell you can't be who you're destined to be. Always go with your inner gut. Listen to those who you respect, and you can have it all. I mean, I'm very lucky, fabulously gorgeous husband, 3 wonderful kids, executive career, all of whom I'm unconditionally proud of. I think I'd be saying whatever you want to do both personally and professionally. It is possible. Dream big, but mostly love what you do.
Fantastic advice. Now, the question is for 15-year-old Charmayne, would she have listened to that great advice?
I think she would have.
Yeah,
I can be convincing, I think, at times. Influential. I like to use the word influential, not convincing.
They say the hardest person to lead in life is yourself, Charmayne, isn't it?
Absolutely.
It's easier. Leading yourself is even harder. Hey, thanks for being on the show today. It's been really awesome. Such great value. So many nuggets in there. I really appreciate your time today.
Thanks, Rob. Pleasure. Take care.
Thanks for listening, and we hope you enjoyed this episode of the It's All Possible podcast. Please subscribe and rate the podcast you listen to so we can continue to serve you and inspire others. Remember, connect to us on all the social media channels. The It's All Possible podcast is hosted by me, Rob Hartnett, and produced by the phenomena that is Finn Hartnett. Connect with us via LinkedIn, Instagram, or the link tree in the show notes.
This podcast is a part of the C-Suite Radio Network. For more top business podcasts, visit c-suiteradio.com.